So I'm Dr. Smitty Heavner. I'm the Senior Scientific Director for the CURE Drug Repurposing Collaboratory, otherwise known as CDRC. And in my role, I primarily oversee our efforts to build and disseminate tools to help extract or harmonize and extract real-world data from the electronic health record. Across that role, we partner with a number of teams across the critical care and infectious disease spaces to help identify targets where we can look for leveraging those networks further. We're currently extracting data on COVID-19 as a good use case for harnessing real-world data because it's a clearly defined disease, one that we understand and one that we can readily pull the data we need. And then the work going forward is to look at expanding that network, those sites that have participated, into gathering other data and helping to work with the open science communities at the Odyssey community and the Infectious Diseases Data Observatory to build and advance the methods to actually conduct analyses on that data to develop hypotheses where we might be able to hand off to other partners to further investigate certain diseases or drugs that can be repurposed. We enjoy a very close relationship with our liaisons at the FDA and the Office of Medical Policy. They have a platform called CURE ID, which has existed for about 10 years, where they are seeking to gather and be a repository for data to be exchanged. The original idea was that this is a space where hypotheses could be generated in rare diseases. But as we look at emerging diseases like COVID-19 or very common syndromes like sepsis, the idea is shifting a little bit into this being one step in a data exploration model where we have a central public-facing clearinghouse where researchers can look to see what data is available, start to formulate a broad hypothesis they might want to investigate further, and then contact with one of our partners like the Society for Critical Care Medicine or the Infectious Diseases Data Observatory, get line-level patient data and conduct really rich analyses. This might also look like working through the Odyssey network, the Odyssey community, to conduct network studies, especially in situations where it may be less feasible to share data because of the sensitive nature of a certain disease or because it's so rare that the disease and diagnosis itself might be considered a diagnosis.